Why don't more doctors practice preventive cardiology? Available time is a reason frequently cited by physicians, but if you probe a little deeper, yes, they complain about not having enough time to give their patients dietary advice, but the number one reason given was their perception that patients fear being deprived of all the junk they're eating. Can you imagine a doctor saying, "Yeah, I'd like to tell my patients to stop smoking, but I know how much they love it"? Changes in diet to reduce cholesterol levels are often assumed to result in reductions in quality of life. Do we get to live longer, or is it just going to feel longer? But contrary to popular belief, this study found no apparent reduction, but rather an improvement in some measures of quality of life and patient satisfaction using medical nutrition therapy as opposed to drugs for high cholesterol. Whereas people taking cholesterol-lowering drugs don't feel any different, this study found that those using dietary changes reported significantly better health and satisfaction and better life in general, more positive feelings and fewer negative. In the family heart study, for example, those placed on a cholesterol-lowering diet showed significantly greater improvements in depression, as well as a reduction in aggressive hostility. Another barrier to preventive cardiology is that doctors don't realize how powerful dietary changes can be. The importance of diet for patients' health remains underestimated by doctors. Even the new drug-centered cholesterol guidelines emphasize that lifestyle modification should be the foundation for the reduction for atherosclerotic cardiovascular disease risk, yet more than half of physicians may skip over lifestyle change completely, jump straight to their prescription pad, doubting that cholesterol goals can be reached with lifestyle changes alone. According to the director of the famous Framingham Heart Study, the best way to manage coronary artery disease is to lower patients' LDL cholesterol and other atherosclerosis-causing particles. You can achieve this with diet plus drugs, but if you can do it with a vegetarian diet, it works even better. In the Framingham Heart Study, those running in the Boston Marathon achieved the goal of getting their total to good cholesterol ratio under 4, but the vegetarians did even better. And if you go all out, putting people on a very high fiber, whole food, vegetable, fruit, and nut diet, you can get a 25% drop in the bad to good cholesterol ratio within 1 week, a 33% drop in LDL. That's the cholesterol reduction equivalent to a therapeutic dose of a cholesterol-lowering statin drug. Medical myths and dogmas die hard. Researchers creating a new body of knowledge for prevention and control of heart disease had to disprove and displace a bunch of doozies. Like we used to think that heart disease was just an inevitable consequence of aging, or that cholesterol and blood pressure just naturally go up as we age. All these are now bygone notions, refuted by massive data, but other long-standing myths and dogmas about our #1 killer epidemic persist. For example, this notion that major risk factors like cholesterol account for a minority of risk, and that many people have heart attacks with no risk factors, so it's just kind of a crapshoot, not much we can do about it. Wrong. There are rare genetic conditions that give people high cholesterol no matter what they eat, but such genetic defects occur in no more than 1 in 200 people. This means, of course, that most persons with atherosclerosis acquire it by what they put in their mouth. The Inter-Heart study showed that for men and women, old and young, in all areas of the world, 9 potentially modifiable factors like diet, exercise, and smoking accounted for more than 90% of the proportion of the risk of having a heart attack, and this has been confirmed in prospective studies. Follow men over time, and those making healthy lifestyle choices associated with a 90% drop in risk. Same with women. 92% of the risk gone. Same with diabetes. 91% of cases could be attributed to bad habits and behaviors. And the same healthy lifestyle which includes not smoking, eating a healthy diet, exercising, maintaining an optimal body weight, may reduce the risk of multiple chronic diseases at the same time, not just heart disease and diabetes, but stroke as well. Up to 80% of strokes avoidable with simple lifestyle changes. How does this all compare to drugs? Why change our diet, lose weight, start exercising if we can just pop some pills? Pharmacological therapies, including cholesterol-lowering statin drugs and blood pressure pills, typically only reduce cardiovascular disease risk not by 90%, but only by 20 to 30%. So even on drugs, 70 to 80% of heart attacks still occur. One of the great things about this study, the Harvard Health Professionals follow-up, is that they also looked at the effect of lifestyle changes on people already on medications. Even those on blood pressure and cholesterol-lowering drugs may still be able to get a further 78% drop in risk by eating and living healthfully. So the choice isn't diet or drugs. Cardiovascular medication should be used as an adjunct to, not just a replacement for, healthy lifestyle practices. It takes time for new science to trickle down into mainstream medical practice. The practice of cardiology and medicine in general may correspond on average to what was being published 10 or 20 years before. So it's important to know if your doctor is still stuck back practicing 20th century medicine.